When I came to TriStar Horizon, I had the full intention to come here and to help grow this hospital and to do big things strategically. And those things are all good and well, but what's happened is this community and the people in this hospital have taught me how to really care about people.
Word of mouth has gotten out that this is a different place. It's a different kind of hospital. People come here and feel like they get good quality care when they come here.
It's turned around completely. They'll tell me that they choose to come here because of the staff and they feel that they get better treatment.
Small enough to care, large enough to heal, I think describes this hospital better than any other slogan. And we really do care about each patient, and we care about the interactions they have and whether or not they feel like they were taken care of. But then I also feel that we are large enough to be able to heal a lot more patients and bigger problems than we have in the past.
I've been at TriStar Horizon for 34 years. I am so proud to work here. I love this hospital. I've loved it from the day I walked in, and I think it's because it's a community-based hospital.
The presence of a hospital and community is a lifeline. I mean, not only is it a major employer, but it's a connection point. You can't overemphasize the importance of a hospital like ours in a town like this.
Emergency traffic board, a 66-year-old male patient. He was found ejected off of his tractor at his house. He did have a possible loss of consciousness as well. Vitals are going to be within normal limits this time. Normal signs will be monitored. Evac 37 calling Horizon Medical Center ER.
This is Horizon, go ahead.
Inbound to your facility of a 40-year-old male, acute onset substernal chest pain radiating of the left arm. Patient does show positive ST segment elevation and leads to 3 ABS.
10-4, trauma 2 on arrival, WQI 378 Alpha.
My name's Marvin Harp. We're in White Bluff, Tennessee. We drove this truck for many years. She drove herself to the hospital in this to have our daughter. I got up here one Saturday morning, told wife, I said, I can't get a good breath. So I just kept pacing around and went outside, tried to cool off because it was cool outside. It was in January. So and just couldn't get eased. So I walked in there and told my wife, I said, need to go to the hospital.
Mr. Harp came to the emergency room with an acute inferior ST elevation myocardial infarction, which is a technical term for an acute heart attack. He was very sick. It was an emergency procedure. I was part of the team that helped take care of him and blunt the heart attack.
It doesn't make sense for one of our patients who's having a heart attack to go 30 or 45 minutes to a hospital in Nashville. We want to be able to provide that care here. And we think that that's what our community deserves. And we've continued to grow. Every year there's been growth in terms of our emergency department volume and our admissions. And with that, our services have grown.
They lost me, and they had shocked me 6 times and done CPR on me to get me back.
I remember yelling at him, basically, I'm not gonna let you die. I wanted him to know I'm here, like, you're not going anywhere. We were gonna do everything we could to, save his life.
They wasn't gonna let me go, and they kept on, so that's just it. They were determined I wasn't leaving.
It's important that patients realize that we're here for them. We have excellent staff, we have excellent nursing, excellent physicians, a lot of state-of-the-art medicine that we can deliver locally.
And the things that we've done at TriStar Horizon in recent years is to build up those services to treat the most critical patient that's relying on a very time-sensitive treatment. It's impacting people's lives every single day, and that's real to me, and that's what's different.
If they hadn't had cath lab people on call, I would not be here.
I coach baseball at Creekwood High School. I'm a volunteer assistant and construction superintendent. We're currently remodeling the hospital. We started out remodeling the ER, and from there moved to all the patient wings. I was playing basketball with some of my friends for some conditioning and having fun. I just felt 2 pops in my knee and then a lot of pain. I basically blew out everything in my knee, tore my ACL, my meniscus, and my MCL.
When I first saw him, he was in a significant amount of pain, and he was very concerned about long-term career, not from an athletic standpoint as much, but just from a functioning standpoint. Coming from an orthopedic injury when I was in high school and learning about the surgery and the recovery period, I do understand from a patient perspective what it's like to go through surgery, to go through rehab.
Seeing Dr. Sauer being an ex-sports guy, a younger guy that I could relate to about things, it was nice having him here local.
One of the reasons I chose to come to TriStar Horizon is being small enough to care, large enough to heal. It really rings true to my heart, and my goal is to take care of patients as if they were a family member, and also to give them good quality care and be able to do that close to their home.
TriStar Horizon has had a labor and delivery unit here for years and years, and we've been able to provide care for multiple generations of families here in Dixon.
I've been here long enough that I've delivered the children of some of the people that I've delivered. All 3 of my children have been born here. That's the biggest evidence that I trust not only the expertise of the medical staff, but also the nursing staff and everyone at this hospital.
My first 2 children were born in Nashville, because that's just what everybody did. By the time we were pregnant with the 3rd one, I just didn't want to make the trip, and I'd heard good things about TriStar Horizon. And so I had a really good friend that we worked together at the bank. She gave me a lot of good information and got me set up with Dr. Hawkins. I was pregnant with my 4th child, chose to deliver and have prenatal care at TriStar Horizon, and 25 weeks is when I discovered a lump in my breast. TriStar Natchez Imaging was the one to actually call me on that Friday and let me know that it actually was cancer. So it was the toughest call of my life.
When she came in for the discussion, went into great detail about what's next, got the appointments, moved things along as quickly as we could.
Their office was even closed on that Friday. And so the nurse came in, who happened to also live on my same road, and we know each other, called and, offered everything and stayed with me that whole weekend. And I put 100% trust and faith into the doctors there. Not only my life at that point, but my baby's life was in their hands. I had 33 rounds of radiation at TriStar Natchez. Did those on my lunch break. If I had to do the radiation in Nashville, I would have missed about 6 weeks of work that I couldn't afford to have missed. The nurses that did my radiation treatments, we didn't always have to talk about cancer. We could talk about our kids. It was nice knowing that they were real people, just like me.
The best part of my job is getting a letter or a note from a patient or their loved one that says, every person that I talked to cared about me. Every person that I talked to smiled at me. Every person that I talked to touched me. The things that we do and the changes that we make and the decisions that we make are going to impact this community and people forever.
I couldn't ask for a better bunch of people. TriStar Horizon saved my life, and they would not let me die.
I'd say I'm about 90%. I'm playing golf. Probably not going to play basketball again. I learned my lesson.
TriStar Horizon saved my life. I'm officially 1 year cancer-free, and I have a healthy, chubby little baby.
It's clear that access to care of the caliber that's provided at Horizon can be life-saving. When people come here, they should expect that we treat everyone like Kristen was treated. You'll not only find that from me, but from everyone that I know that works here, and that's really a special thing.
TriStar Horizon really is small enough to care, but we're also large enough to heal. That really does define who we are. In most hospitals, it's the hospital caring for the community. What's unique about this is it's the community caring for the community.